afternoon, everyone. Myself, Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about lung volume and capacities. So they refer to volume of air associated with different phases of respiratory cycle. Lung volumes are directly measured. Lung capacities are inferred from lung volumes, and instrument is usually spirometry. So spirogram. So we are having the volumes and capacities like tidal volume, residual volume, inspiratory reserve volume, expiratory reserve volume, and vital capacity, total lung capacity, functional residual capacity, inspiratory capacity. So, what is tidal volume? The normal volume of air inspire and expire during quiet breathing, which is 500 ml. And inspiratory reserve volume is additional volume of air which can be inhaled after tidal volume, which is usually 3000 ml in adult male. Expiratory reserve volume is the extra volume of air that is exhaled after tidal volume, which is 1100 ml. Residual volume is volume of air left after forceful expiration or complete expiration, which is 1200 to 1100 ratio male to female. Inspiratory capacity is maximum volume of air that can be inspired after normal tidal expiration. So it is 3500 ml. Expiratory is maximum that can be expired after normal tidal inspiration. So it is 1600 ml. There is also a functional residual capacity, means the volume of air remaining in lungs after normal tidal expiration, which is usually 2300 ml. There is also a significance like there is continuous gases exchange, so concentration of oxygen, carbon dioxide is maintained. Breath holding is made possible, and dilution of toxic inhaled gases, prevention of lung collapse. It also reduces the respiratory muscle workload and right ventricle. Vital capacity is maximum amount of air expelled after deepest possible inspiration, which is 4600 ml. So basically, the significance is to assess strength of respiratory muscles. Total lung capacity, the volume of air present in lung after maximum inspiration, which is 5800 ml. So this is the spirogram shown in which all the volumes and capacities are shown in relation to time. So we are also having dynamic lung volume. So timed vital capacity, or we can say forced vital capacity, volume of air that can be expired rapidly with maximum force following a maximum inspiration. It is timed by spirograph. So FE1 is volume of air expired in the first second, that is FE1 of that is forced vital capacity. It is basically FE1 is a flow rate. FE1 is expressed in percentage, like 80% volume of air expired forcefully in 1 second, then in 2 seconds, and then in 3 seconds. So basically, percentage increases. So there is also forced vital capacity, means the volume expired by forced maximum expiration from position of maximum inhalation. Then forced vital capacity in 1 second is like volume of air expired in first second of maximal forced inspiration from position of full inspiration. And then forced expiratory flow from 25 to 75% of exhalation. The average flow rate during the middle 50% of forced vital capacity. Minute ventilation or pulmonary ventilation. The volume of air inspired or expired per minute, that is 6000 ml, or we can say 6 to 7.5 liter per minute. Maximum breathing capacity, also known as MVV. So the maximum volume of air that can be ventilated voluntarily for given interval of time. So usually the subjects are asked to deep breathe or rapidly for 15 seconds, which is then recorded by the Douglas bag or spirometer. Normal is usually 80 to 170 liter per minute, and it is reduced in patients with emphysema or respiratory muscle weakness. Breathing reserve or pulmonary reserve is the amount of air above that PV and which can be expired or inspired in 1 minute. So usually the pulmonary reserve is equal to maximum, we can say MVV minus PV, and expressed as percentage of MVV and is known as dyspneic index. So next we are having the alveolar air, which is usually the air available for gases exchange in alveoli per breath. So, what are the factors affecting composition of alveolar gases, like quantity and quality of gases delivered to and from by ventilation, diffusion, rate of gases, the cardiac output? So, these are the factors affecting, and then ventilatory factors affecting the alveolar gas composition depend on the amount and kind of gases delivered to alveoli by ventilation and on rate of gas diffusion. It also depends upon pulmonary blood flow, which continuously deliver carbon dioxide and remove oxygen from alveoli. So this is the composition of alveolar gas. It contains more carbon dioxide and water vapor than atmospheric air. So at atmospheric, or we can say sea level, it is shown. Then the rate at which alveolar area is renewed. So only 350 ml of new air is brought into alveoli with each normal inspiration. And this same amount of old alveolar area is expired, so that multiple breaths are required to exchange most of the alveolar air. So these are the references. Thank you.